Okay, this video is called 87% cure rate for type 2 diabetes. And this is about a recent study done in China. And they took a bunch of type 2 diabetic patients. There were 61 patients in total. And they put them on a diet that was actually kind of high protein, and I would consider it high fat. 25% of calories from protein, 25% of fat. So as soon as you hear that, you know it's a bad diet. Then the question is, well, if it's such a bad diet, how did the patients successfully cure their type 2 diabetes? And the reason they did is because they kind of partially starved them. They had dietitians working with the patients, and they lowered their caloric intake by about 500 calories per day. So they set it up so that they could get about anywhere from 1 to 2 pounds weight loss per week was the goal. And what I'm trying to say here is that anytime you get the patients to lose over 30 pounds, Roy Taylor already showed this. He won the Banting Award in 2012. Roy Taylor had shown if he could get his patients to lose over about 30 pounds or so, all of his type 2 diabetics of duration, having type 2 diabetes less than 4 years, they were all cured. Okay, so this study basically just essentially repeated that same result. They found they were able to get 87% of their type 2 diabetics to go into remission. For the pre-diabetics, they got about 73%, 75%, but they didn't get them to lose as much weight. For the intensive treatment group, they had them exercise more. They had a lot of heavy supervision, lots of doctor visits, dietitian visits, patient education. And that's another thing. There's something called the Hawthorne effect. The Hawthorne effect means the more you study a patient, the more attention you pay to them, the more effort they're going to make. So they'll get a good result in part because of that. I'm also going to make a criticism of Kempner. Kempner's patients, he had incredible cures. Nobody had ever seen anything remotely as good as what Kempner had done. But Kempner didn't educate his patients as much as he could. And some of his rice diet patients, they would go home and they couldn't maintain the rice diet. So what I'm trying to say is, what does this all mean? What this all means is that, McDougall's advice was the best. It's nice that these patients were followed for 1 year and they were able to get their blood glucose under control and achieve normal glycemia, normal blood glucoses, okay? They were also on medications, many of them. But what I'm trying to say is, you need a realistic scenario for the rest of your life. Yeah, it's nice that under very tight, close medical supervision, they were able to get their blood glucose under control within a year. But what I would say is, so what? You need to have it in control the rest of your life. And how are you going to get it in control the rest of your life? You have to have a diet that you like that's doable. And the low-fat, low-sodium vegan diet with starch-based is super easy to do. It's easy. Once you eat this way, you want to continue this way. There's no effort involved. Okay, so anyways, you're going to hear everybody saying how wonderful this diet is. Isn't this magnificent? They got 87% cure rate. But I would say all they did was starve these patients for 1 year. No shit, you cured them. Everybody knows if you starve a diabetic and make them lose more than 30 pounds, you'll cure them. Okay, it doesn't matter how you lose the weight. McDougall had joked, you could get a patient to lose 30 pounds with chemotherapy, with, all these types of things. But if you want to have a good long-term result, the patient has to find an eating style that they like. And here's just showing you the illustrations from, or actually, let me go back and show you the little more details about what they did with the patients. And this is like I just said. They had them on medications. They prescribed them 25% protein, 50% carbohydrate, 25% fat, which is a crap diet. But they restricted them so they would lose weight. That was the teaching point. Make them lose weight, all right? Here's the graphs just showing that they got 87% cure rate in the diabetics, 75% in the pre-diabetics. The reason why they cured less of the pre-diabetics is because they didn't lose as much weight. So the diabetics lost an average in 1 year of 42 pounds, 19.2 kilos. Well, of course, no shit. You'd expect them to be cured of diabetes if you did that, okay? What I'm trying to tell you is don't be fooled because, I've heard some other internet commentators saying, oh, this is wonderful. You don't need these low-fat vegan diets to treat your diabetes. You can do it with any diet. Bullshit. You can do it for 1 year with a high-protein, high-fat diet under tight coaching and calorie restriction. You got a dietitian measuring your food every day, making sure you stay below what it takes for you to gain weight. But that's not the real world where you're by yourself. You have to pick all your meals by yourself. Here's just a Roy Taylor paper where he'd done essentially the same thing a long time ago back in, he won the Banting Award in 2012. And he got his patients to lose about 30 pounds or more, and they all were cured of their diabetes. What he said happens is everybody has their personal body fat threshold. And if you just get their body weight below their threshold, so to speak, their diabetes goes away. Okay, yeah, diabetes is a disease of fat. The fat was first lost from the liver. Okay, that's the most metabolically active fat in your body. And when you got them to lose more than 30 pounds, they all cured, their blood glucose came down to normal. Okay, so that's great, but still, the point of the whole study is how do you do it? Actually, I don't want to go to this study, this paper. How do you get the patient to do it and sustain it the rest of their life? And the answer is low-fat, low-sodium vegan diet, because then the advantage of that is you don't have to calorie restrict them. They can eat as much as they want. On that diet, people just naturally tend to go to their optimal body weight, and they don't have diabetes. And if they had type 2, you cure them. So that's how you win the game, because you want to win the game the rest of your life. You don't want to just have all this stuff that if you had to pay out of pocket, it would be very expensive, this close supervision with a dietitian checking your diet every night. So anyways, that was the point I wanted to make, that the paper is nothing to be excited about. It's information we already knew about, and it still doesn't show you what you need to know. Eat a low-fat vegan diet. McDougall's right. When in doubt, McDougall's right. I agree with McDougall on almost everything. There's a few things I disagree with McDougall. I think he was a little weak on the problems with sodium. He didn't know about the K factor, so he didn't understand that. Okay, I think he underestimates the value of sleep. But there's not too many other things I disagree with him on. Okay, and he's right about this. McDougall knew what it took to be healthy. He worked with many thousands of patients, and he made a big effort to figure out what was true. So you got the answer. It's not rocket science.